The Ontario Hospitals Association tweeting this today. We're now in wave 3, referring to data from the province's science advisory table, which shows ICU numbers trending upwards and a steep rise in cases of variants of concern. Ontario's Chief Medical Officer of Health agrees.
We are into that base of a third wave.
He says modelers are assessing the situation.
What does that mean? How big it is? That's to be determined. And we can collectively seek to put input on that if we are careful, if we maintain public health measures.
Toronto's top doctor, meanwhile, says variants of concern are resulting in a new pandemic, with more than 3,500 people in the city screening positive for virus mutations since the beginning of February. But Dr. Eileen de Villa stopped short of saying Toronto is in a third wave.
It's still early to say. Certainly this is not the direction that we want to see the numbers go in.
She says the phased vaccination plan and following public health measures will help reduce spread of all strains of the virus.
I think we actually have a great deal of control here. We know what actually makes a difference if we would like to see those numbers turn around.
Ottawa-based epidemiologist Raywat Deonandan says the starting point of a pandemic wave is not always clear, and we could very well be in one right now.
We never really know if we're in a so-called wave until we're deep into it, or sometimes even until we're past it. But if I had to guess, I would say we're at the beginning of one, absolutely, because we see it happening in Europe.
He adds, although the B117 variant that originated in the UK is more contagious, the third wave is projected to be overall less deadly.
We have managed to vaccinate all of our long-term care residents and most of our retirement home residents in Ontario. And we are now starting the process of vaccinating our community-dwelling elderly, which means the likelihood of death is lower. That leaves us, though, with the shifting of the targeted demographic from higher age groups to lower age groups.
Deonandan says those most affected by the third wave will likely be in the 50 to 65 age group, many of whom have yet to be vaccinated. Jessica Ng, CBC News, Toronto.